Welcome back to On the Beat, everyone. I'm over here with Dr. Gregory Childry and Dr. Clay Hudson, and we're talking all about women's health, not only internally, but also externally. Of course, they are the people that run Columbus OB/GYN Specialty Centre. How are you, my friends?
We are good.
Okay, thanks for joining us again. I want to talk a little bit about, for people who don't know the services that you offer, what are the ones that you do at your clinic?
Well, of course, we do obstetrical care for pregnant women. We do prenatal planning and work with patients with family planning, birth control. We do routine GYN examinations and take care of cancer screening for women.
Oh, you do?
Yes, as well as surgical procedures, including robotic surgical procedures and some infertility procedures.
Okay, but it is a women's clinic, correct?
It is.
Okay, now I want to bring you into this conversation, Dr. Hudson. One of our viewers wrote in, when should a pregnant patient first seek care with her pregnancy?
We always say as soon as possible, so we can identify the risk factors that they do or do not have. And also, we usually get ultrasounds in the early part of pregnancy, around 6 to 7 weeks.
Okay. And you said something off camera that people sometimes, is it over the counter?
Yeah, even the over-the-counter pregnancy test will show a patient if they've got a positive test before they miss a menstrual period.
Really?
So that can create some controversy and problems for them, because when they call up and say, you know, I've just found out I'm pregnant, when should I come in and find out for sure? We have to make sure they're far enough along in the pregnancy that the ultrasound will even show where the pregnancy is.
Really? So what are you saying to them? You have to wait a few extra weeks? Or?
Usually, because you can get into problems with chasing hormone levels and those types of things if you do ultrasounds too soon.
Okay, this is a question for both of you from another viewer. Do routine screenings for women have a benefit? For example, mammograms, pap smears, physical wellness examinations?
Yes, they do, because we're trying to pick up abnormalities and cancer as soon as possible when it's most curable. And pap smear is still the standard of care for cervical cancer screening. Mammogram still standard of care for breast cancer screening. And physical exam still plays a part, where we find things on physical exam that the patient doesn't even know they have.
Okay, you're doing ultrasounds in your...
Absolutely.
And who's doing them?
Both of us.
Okay, got you.
So in this day and age, it's almost impossible to do obstetrics and gynecology without the ultrasound. So, you know, that's a big part of our practice as well.
What are some of the concerns out there that you see women, and you want to get that point across about their own health? You know, because we know men don't take care of themselves. What is the message you want to get out to your potential future patients about taking care of themselves? Because mothers just don't.
Yeah. Well, a lot of times the people think that they're not supposed to come back maybe after a hysterectomy, that they don't need to see us anymore. But there's still problems that we can help screen for and try to keep them out of trouble.
Dr. Hudson, what are some of the things that you see coming into your office that women should be taken care of, but they're not, because we all know women think of themselves last?
Right. Well, first of all, we always talk about cholesterol screening and diabetes glucose screening.
Of course.
As well as the pap smear and mammograms and those types of things. So it's kind of a holistic approach that we use. It's not just, you know, the female issues. We like to look at everything, and blood pressures and those types of things.
Okay. Doctor?
Urogynecology, which is a field of women's bladder function as well as the female function, is something that a lot of women come to us for, because they have trouble with bladder control or issues with their bladder, and we help try to evaluate that and treat their problems as best we can.
How are we going in the state of Mississippi when it comes to breast screening for women? Are we behind the national level, or are we on par?
Well, in our area, we're on par. We have in our area mammogram screening devices that are the standard of care, as well as ultrasound for the breast and MRI treatments for the breast.
Well, that's good to hear. Again, thank you both for coming in. Looking forward to having more of a conversation with you. If you want to find out more information, there's it all is up on the screen, everyone. Columbus OB/GYN Specialty Centre, Dr. Childry and Dr. Hudson. We'll be right back after this short break.